and Assalamualaikum. My name is Syahirah Binti Azahri. Today I would like to present about the article that I have read, which is an overview on audio, signal, speech and language processing for COVID-19 with my Raya outfit. As of today, there have been over 4 million reported cases of coronavirus-induced COVID-19 infection in over 200 countries. As a result, there is a greater need for monitoring, diagnostics, awareness, and post-care equipment and procedures for a large population. The World Health Organization (WHO) has described the COVID-19 main symptoms as high fever, coughing, and breathing problems for the purpose of diagnosis. However, since the coronavirus is so new to humanity, the virus' peculiar effects and human immunity to it are also found to differ from person to person. Because of these complexities, it is best not to depend solely on digital sensing to diagnose the infection, and many physicians are worried about a false alarm that AI-based diagnosis will produce. Physical and mental health concerns have risen, necessitating the use of AI to provide options that are both fast and easy to reach. There are several different algorithms using audio processing for screening and diagnosis of COVID-19. Cough detection is not only identifying the cough sound and differentiating it from other sounds such as speech and laughter, but also to identify COVID-19 specific cough. This requires to collect the COVID and non-COVID cough sound samples so as to develop an AI model that can differentiate between them on its own. They will need these audio samples to be their machine language algorithms for identifying COVID-19 cough. As previously mentioned, shortness of breath is one of the virus effects, and mobile applications are programmed to capture breathing patterns by tracking the voice signals. Breathing pattern analysis has also been used in spectrometry to analyze lung functionalities. In addition to speech signals, blow sound may aid in the performance of spirometry tests. While these algorithms achieve high precision ratings of more than 90%, coughing on an exposed surface is not recommended from a hygiene standpoint. As a result, during the sampling processes, it is important to remind participants to close their mouth and only include cough sound samples. Otherwise, this may lead to the disease spreading much faster. The number of positive COVID-19 cases grows day by day. It highlights the importance of automating the dialogue that a psychologist will have to recognize the existence of symptoms in a person. Microsoft and Center for Disease Control and Prevention (CDC) has developed a chatbot called Clara to track COVID-19 patients by asking them questions and recording their answers. It can distinguish between 20,000 diseases with an accuracy of more than 90% and distinguish COVID-19 from the other diseases with identical symptoms with an accuracy of 96.32%. Several groups are working together to create a classifier to diagnose COVID-19 signs using a chest X-ray. According to the study, frequency and distribution of chest radiographic findings in COVID-19 positive patients, chest X-ray findings in COVID-19 patients peak at 10 to 12 days after symptoms onset. In addition, uncertain methods also necessitate a visit to a well-equipped clinical hospital. On the plus side, in the case of mobile X-ray devices, this technique will aid in diagnostic pace. Precautions preventing the virus transmission include social isolation, wearing a mask, and practicing a good respiratory hygiene. There are several monitoring tools created for COVID-19 scenario. Collecting cough sample without covering the mouth will result in greater disease spread. Hence, mask wearing must be needed for cough sample donation, necessitating the use of an app to detect whether or not the donor is wearing a mask. The compare task includes a mask recognition sub-challenge with the aim of determining whether or not the speaker was shot while wearing a face mask. The result of this competition will be useful in creating a speech monitoring method that detects a speaker's mask or no mask, which will serve as a requirement for other speech recognition algorithms. During quarantine, physicians must record patients' cough histories, which can be accomplished with a continuous cough detection system. The FluSense framework has created one such monitoring program. It is a screening technique that uses cough sound to diagnose influenza-like disease in hospital waiting room. Continuous monitoring and identification of abnormalities from the breathing rate has been done using image processing. The disease spread has had an equal impact on individuals' physical and mental well-being, owing largely to a slew of obligatory precautionary steps, such as social isolation and working from home. The behavioral parameters detected from speech include sleep consistency and anxiety with a precision of 0.69 as compared to comparable self-reported measurements as ground facts. According to the speech, such as age group, such as the elderly above the age of 60, are more vulnerable to the infection. This demonstrates the importance of understanding the impact of this process on their neurological parameters such as emotions. It is critical that officials keep an eye out for people wearing masks or not in public places, particularly in densely populated areas such as airports, train stations, and hospitals. Lee Weiher's Apple Store software can be combined with the current configuration of Internet Protocol camera to receive warnings while finding a no mask on the face. The application allows you to connect phone numbers to get warnings, as well as a mechanism to see the admin's face while they are not wearing a mask. Machine learning approaches are being used to categorize emotion from press-gaining patients' experience study. According to the findings of this study, patients have made unvariable opinions about the cleanliness and logistics and variable comments about their encounters with clinicians. To have human-like communication, speech recognition and synthesis algorithms have been widely used in the development of chatbots. The comment in the moment of crisis, chatbots are assisting in disseminating important knowledge about COVID-19 to end users. When an affected person is healed, they will assist researchers not only with their expertise but also by donating components such as plasma. Microsoft has created the chatbot 9 for plasma processing, which communicates with individuals to gather the necessary details such as the time for which they have checked negative, the age, the weight, and also takes their PIN code to help them find the closest donation site. Since the work culture is shifting toward working from home, it will be necessary to predict certain behavioral criteria such as anxiety and sleepiness for working professionals self-monitoring. Obtaining appropriate and reliable speech data for building machine learning algorithms is a significant challenge, considering social distancing norms. From the standpoint of chatbot architecture, there are additional problems. The benefits and disadvantages of using chatbots for exchanging the most up-to-date information, promoting desired health improving behaviors, and reducing the psychological harm caused by fear and isolation. This demonstrates that the functionality of chatbots should be carefully considered when using them. Otherwise, they will have a negative effect. The majority of the speech-based testing works for COVID-19 screening and surveillance are able to be customized. While having the most potential use cases, chatbots are also need context-aware designs. Since the majority of first-level symptoms are linked to the respiratory systems, doctors and healthcare professionals may deliver treatment while adhering to social distancing standards by continuously recording patients using audio signal processing based technique. That is all from me. Thank you and Assalamualaikum.